in the DHS Bureau of Communicable Diseases, and Ryan Nilsestoon, the Chief Legal Counsel in the Office of the Governor. We'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everybody, and thanks for joining us again today. As the COVID-19 pandemic continues to affect our small businesses, our workers, students, parents, and the health and safety of our friends and neighbors, earlier this month, I called upon the legislature to pass legislation to address our most pressing COVID-19 response needs. This week, the state Senate amended and passed AB 1. And while it's not the COVID compromise we originally proposed, it's a great start to support our state's response to this pandemic, and it is a step in the right direction. I've been grateful to work together with Republican Senate Majority Leader LeMahieu to find common ground and pass a bill that reflects a good faith effort to compromise and be bipartisan. Not only do we need to pass this bill to continue our state response, but Wisconsinites believe, as I do, that we can and should put politics aside and work together. So I'm calling on the Assembly to pass this bill as amended and send it to my desk without delay. Let's get this done, and let's start this legislative session on the right foot. Our state and communities can't afford to lose any ground this late in the game, and the challenges we faced in 2020 didn't go away with the new year. Our families and workers still need help making ends meet. Our small businesses still need our support to keep their doors open. And our state's response, including testing and tracing and distributing PPE, must continue until we get Wisconsin vaccinated. And folks, it's going to take time. I know we are all anxious to get vaccinated and get back to the life that we knew. And we're going to continue, just as we have all along, to distribute the vaccine safely, efficiently, and fairly. And just as I've been saying, we need more vaccines to lead the way in vaccine distribution. For over a month now, I've been calling on the federal government to make sure Wisconsin not only had our fair share of vaccine, but even more than our fair share, as most of our statewide mitigation strategies have been cut down or are presently in litigation. Earlier this week, we are happy to announce that on Monday, we will be taking our first steps into phase 1B of the vaccination program, including opening up the vaccine to our frontline first responders, such as EMS, firefighters, and law enforcement. In addition to that, today we're excited to announce that on Monday, we'll be launching our mobile vaccination teams pilot program. Our mobile teams will work to support these local and tribal health departments in their vaccination efforts, especially now as they are leading the coordination of getting vaccine in the arms of our first responders, along with our unaffiliated healthcare providers. The teams will be staffed by the Wisconsin National Guard, as well as pharmacy and nursing students from the UW system. This program will start with 9 teams, and we are looking forward to expanding from there. But folks, I've said it before, and I'm sure I'll say it many, many times again. In order for the vaccine to do its job in the months ahead, we have to keep working together to stop the spread of COVID-19 today. So, as many of you might know, our public health emergency and face coverings order are set to expire next week. But we know we have to have a long road ahead of us before we can get back to our way of life. That's why today we're also announcing that we will once again be establishing another public health emergency and maintaining the statewide mask requirement for another 60 days as we continue to work on distributing vaccines across the state. Because while there's light and hope at the end of this tunnel, this virus hasn't gone away. In just a 4-day period from Monday through Thursday this week, 9,092 Wisconsinites tested positive for COVID-19. 426 were hospitalized, and 133 Wisconsinites unfortunately passed away. So folks, don't give up now. Wear your masks, stay home whenever you can, support businesses, and catch up with families virtually. And let's get together, let's get through this pandemic together. If not for ourselves, for the 5,290 Wisconsinites who are no longer with us. Thank you so much. And now I'll turn things over to Previa CEO, Dr. Ashok Rai. Dr. Rai.
Thank you, Governor Evers, for the state of Wisconsin's unwavering support and partnership throughout this pandemic. Prevea Health continues to be extremely honored to partner with local public health departments and the state of Wisconsin throughout this pandemic, from COVID-19 testing efforts to the more recent undertaking of our COVID-19 vaccination efforts. We could not be where we are at today without these partnerships. They are vital as we have gone through the process of vaccinating our own healthcare workers and then vaccinating unaffiliated 1A healthcare workers. When it came to planning and executing our own vaccine launch, my motto and guiding principle was to aim small, miss small. When launching our internal vaccination clinic, we started small on the first day to make sure we learned from our own experiences in order to begin scaling up. And we did just that. We learned and we quickly vaccinated our own, as well as our hospital partners' employees. Then we met the goal of vaccinating our unaffiliated 1As and have since delivered almost 9,000 doses of vaccine since December 16th, 2020. We will take this commitment to the next level as we unveil Prevea's first mass immunization clinic on the campus of the University of Wisconsin-Green Bay next week. This is the largest vaccination effort of our lifetime. What makes this extremely special is this month also marks the 25th anniversary of Prevea Health when it was introduced to the Green Bay community. After we ramp up and are operating fully at full capacity at UW Green Bay, and pending on vaccine delivery from the federal government, we will be administering 10,560 COVID-19 vaccination doses a week, and that will be remarkable. But for us, it doesn't end there. We continue to scale up in the coming weeks at other locations in the communities that we serve with the goal of administering 20,000 vaccines a week to the public. This would not be possible without the partnership we have with our local public health departments and the state of Wisconsin, as well as our Wisconsin University system. We hope that the federal government will continue to provide us with the vaccine supply to help us meet the goal of delivering as many vaccines as we can throughout the entire state of Wisconsin. It's now my honor to turn things over to DHS Deputy Secretary Julie Williams-Van Dyke.
Thank you, Dr. Rye, for sharing about Prevea's vaccination efforts and for all the work you and your system have done throughout this pandemic. You've been a fabulous partner. And we also appreciate the incredible work of all of our healthcare partners. We are all in this together, and that is what we need to focus on as we move forward. What a week it's been in the Wisconsin vaccine rollout. As of today, we have administered 213,056 doses of COVID-19 vaccine here in Wisconsin. That includes 30,780 second doses, which means 30,780 of our healthcare workers or nursing home residents in Phase 1A have completed their vaccine series. Most of these second doses have been administered this week. Yesterday, we launched new updates to our vaccine data page to include completed series as well as data on COVID-19 vaccine administered per day, broken down by region and by county. So you can watch the progress that we are making across the state. We started this week by calling on the federal government to allocate more vaccine to our state. I want to be sure when Dr. Rye asks us for vaccine to run those clinics that we have it to give to him, and that is dependent on the federal government. Unfortunately, on Tuesday, we learned the federal government intends to release the second doses of vaccine that they had previously held back. And today we are hearing that may not happen. This announcement and the subsequent follow-up is bringing up lots of questions when it comes to frequency, timing, and long-term planning, and we are still waiting for answers to those questions. This week, we also announced $86 million in funding for local and tribal health departments to support testing, contact tracing, and vaccine administration. Just like our healthcare partners, our public health partners have been and continue to be on the front lines doing life-saving work. And this funding will help make it possible for that work to continue. To support these vital partners in their vaccine administration, as the governor mentioned, the mobile vaccination team pilot program will start next week. This pilot program will start with 9 teams and then will expand, helping ensure access to vaccine in every corner of our state. We will also increase access the following week when partner pharmacies will begin vaccinating residents and staff in Wisconsin's assisted living facilities. That will be possible because we activated Part B of the Pharmacy Partnership for Long-Term Care program this week, and that program requires states to have vaccine banked before day 1 of vaccinations. So our vaccine team has coordinated that launch date to ensure that this requirement was met. All the steps we've taken this week, the announcements I just listed, and all the ongoing work of the vaccine team at DHS and vaccinators across the state are what's strengthening our response, and it makes it possible to get more vaccine to more residents in Wisconsin. And as we expand our efforts, we want to make sure you're well informed, which is why we are starting a weekly email COVID-19 newsletter. You can sign up on our website to receive information on the COVID-19 response and vaccine rollout in Wisconsin directly in your inbox every Friday. You can find the registration link at dhs.wisconsin.gov/COVID-19. I'll conclude today with the numbers describing the pandemic. We are adding 2,269 new cases that were reported today, which brings our total confirmed cases of COVID-19 to 518,251. Our 7-day average of cases is 2,319. Today, we are reporting 32 more Wisconsinites who have lost their life to COVID-19, which brings the total number of deaths to 5,322. Our thoughts continue to be with the families and friends of all of those folks who have lost loved ones. As the governor said, these case numbers and lives lost remind us that we must do everything we can to stop the spread. So I'm going to say it again. Please stay home, spend time with the people you live with, and limit your trips outside of your home to the essentials. Wear a mask, physically distance if you wash your hands frequently, and as we continue our vaccine rollout, we want you to remember these are the best steps you can take to keep yourself and your family safe. Thank you, and with that, we all look forward to taking your questions.
Well, thank you, and we will now take those questions. A reminder to maintain audio quality. Please keep your phones on mute until it's time to ask your question. We also want to remind you that we have a hard out at 2:15 this afternoon, so in order to give all of you a chance to ask a question, please only one question per reporter per outlet. And we'll begin this afternoon with Mason Dowling from WAOW-TV in Wausau. Mason.
Hi, thanks for taking this call. This is realistically for either the governor or the DHS, whoever feels like asking it. But there are concerns from more rural health clinics and health officials in the counties that rural populations won't be seeking out the vaccine. Is there anything being done to ensure that it gets to them and that they receive it?
Well, I'll just make a quick comment and then ask Julie to follow up, or Dr. Westergaard. But clearly, we believe that this pandemic has not just affected those of us living in urban areas of the state. It's affected those of us that are living in rural areas of the state. And so we have been going, making sure that we've made it available to folks in the rural part of the states. In fact, I was with a group of tribal leaders this last week that were talking about the fact that they've had good cooperation with the counties that they coexist with, and getting the vaccines for them and for others living in those rural counties.
Yeah, and I just follow up on that, Governor, and say we are working very hard to distribute vaccine to clinics, pharmacies, local health departments, tribal clinics throughout the state. With the Moderna vaccine, it is certainly an easier task. That vaccine does not require the ultra-cold storage that the Pfizer vaccine requires and can be delivered directly to a clinic or a health department in a rural part of the state. But we've also delivered Pfizer vaccine to clinics and health departments and hospitals in rural Wisconsin. Once it's unfrozen, you can use it for 5 days. It requires everyone along the chain to be really clear about how many doses you can actually use in 5 days. But we've made multiple deliveries to counties across the state of Pfizer vaccine as well. So we have every intention of getting vaccine into those communities. I can also tell you rural providers and rural health departments are standing up clinics and getting to their unaffiliated healthcare providers and their police and fire. People in rural clinics and rural communities know each other. It's easier to find those people and let them know where the vaccine clinic is going to be, and they do a fabulous job of that.
Thank you, Mason. Now to Heather Poltrak from WSAW TV in Wausau. Heather.
Hi. Last week, Alex Azar said that sometimes what looks like a slow vaccination process is actually just a delay in vaccinators reporting doses administered. And I'm just wondering if you can talk about what that process is and the amount of days that a vaccinator has to report when vaccinations have been administered.
Sure, I can take that question. We ask all vaccinators to report their vaccines into the Wisconsin Immunization Registry within 24 hours, although we do give them a grace period of 72 hours to get their vaccines into the system. And I would say the great majority are. We do see a few doses straggling in beyond that date, but the good news is in our state, we've had the great Wisconsin Immunization Registry in place for well over a decade, I think 15 years or so. And so we have electronic interfaces in place with most of the electronic health records in the state. So once the vaccine is put in that health record, it's electronically transferred into the Wisconsin Immunization Registry. And our vaccinators are quite familiar with this system and know how to do it. The one thing I will say is we're seeing much more of a delay from our state Wisconsin Immunization Registry into the federal CDC system that they're reporting publicly, the CDC data tracker system. And we're working on why that is, because our daily doses are, we're several days ahead of the CDC. And that makes it difficult when you're comparing from state to state, because we always have given far more doses than are appearing on the CDC site.
Thank you, Heather. Now to Todd Richmond from the Associated Press. Todd?
Hi there, Governor. I was wondering if you had any comment on some of the impending riots or violence or gatherings, however you want to call them, coming up this week, and how serious this danger is to the state capitol here in Madison and the rest of the state.
Thanks, Todd. And of course, what a lot of people are focusing on is Washington D.C. as well they should, and it's clear that things are, there's lots of military folks in Washington D.C. Protecting Congress and the president-elect and his staff. But in Wisconsin, we are in constant contact. In fact, I know at the end of this day, I'll have another briefing on security. We have National Guard in place close to the Capitol, as well as people from the State Patrol, Capitol Police, Madison Police. They're all working together. I feel very confident. This weekend the Capitol is closed, as it has been since the pandemic, because there's no Assembly or Senate session in place. and we are well prepared. There's lots of rumors going around, and clearly we are not overreacting and certainly not underreacting, but we feel confident that we're in a safe place here around the Capitol.
Thank you, Todd. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell.
Yeah, thank you very much for the time today. Just real quick one and then a follow-up. Just for clarity, does this mobile program launch on Monday or Tuesday? I think I heard 2 different dates. And then with regard to those mobile teams, can you put any additional details on kind of what those are going to look like? And if there's any sort of an idea on kind of what the daily or weekly vaccination, capacity for those might be? Thank you.
Sure. Actually, the first scheduled clinic with the team is, teams are scheduled for Tuesday. The teams are composed of, I don't know the exact number, but about 12 to 15 people. This includes people who do registration, people who actually do vaccination, people who help with guiding people through the process, and of course, the important task of staying with people while they're in the observation period after they've had their vaccination. A team is, as Dr. Rai said, we're starting small to learn, and we will grow as we move forward. I remember in the days when we first started our mobile testing teams, and we thought a team could do 150 tests per day, and we very quickly refined our processes, and to the point that we had a team able to do nearly 600 or 700 tests per day. And I think we'll see similar increase in our ability to conduct vaccines. Right now, they're thinking they're going to be able to do about 70 to 140 tests per day, and we'll test that out and we'll see how it goes, and we'll grow from there. I think it's also really important to remember doing a nasal swab is very different than giving this vaccine, because this is a vaccine under emergency use authorization. We know there have been incidences of anaphylaxis in regard to it, and so we want to do this as safely as possible, not as rushed as possible.
Thank you, Mitchell. Now to Nikki Madanovich from NBC 15 in Madison. Nikki. And a reminder, *6, unmute your phone. Nikki Madanovich.
Thank you for that. Just a question about any potential vaccine overflow from phase 1A. Per DHS, what is the protocol if there is any vaccine left over, if people who are eligible in phase 1A have gotten vaccinated and there's any left over, what is the protocol for that? Where does that vaccine go?
So if our vaccinators have finished phase 1A in their community, they have 2 choices. One is they can wait for phase 1B, or if it's a significant amount of vaccine, we would ask them to call us and we would come and get it and redistribute it to others who are vaccinated 1A and need further vaccine.
Thank you, Nikki. Now to Danny Maxwell from WKOW-TV in Madison. Danny?
Hello, this is AJ Biapor filling in for Danny. Thank you so much for doing this call. Following up on the last question, we have a school district in Janesville that had organized a mass vaccination clinic for next week. DHS about that has said that Mercy Health should not have moved forward with planning that with what sounds like excess vaccine after clearing those in phase 1A. To be clear, should they have to wait, in this case possibly more than a week, to get that vaccine into the arms of people who are not certified in phase 1B? Or if you have a bunch of willing participants and you can logistically get this set up, why not allow these people to get vaccinated as soon as possible?
So let me say a few remarks, and Governor, if you want to add anything. First of all, what we're really trying to do is cover certain populations first and then move on to other populations. And that is what creates an equitable situation across the state. And so we've worked with each of our vaccinators. They sign an agreement with us and the federal government. I think it's important to remember this vaccine is an asset of the federal government that is given to states and by states to local providers. And we've asked people to follow the same rules together. In fact, they've signed a contract to do that. So as I said earlier, if people have excess vaccine, we ask them to let us know and we'll redistribute it to get to the appropriate population. Now, we're not going to wait till all of phase 1A is done before we open the door to phase 1B. We've already done that, as we've said, because we're already going to start with fire and police, and I anticipate other populations will be coming sooner. Governor, do you have anything else you'd want to say about that?
Yeah, it would have been helpful if there had been some communication around that issue. Now I know they've made that announcement in their community, and I think it's going to be hard to undo that, frankly, without people would be taking off work or getting childcare, whatever, in order to be vaccinated. So while we would have preferred a different outcome, the fact of the matter is they made these plans, they announced it publicly, and they will likely go forward with that.
Thank you, AJ. Now to Stephanie Hoff from WIS Politics. Stephanie.
Hi, this is Royce Pedezwa filling in for Stephanie. Governor Evers, do you have any response to the Assembly Health Committee that asking you to speed up the vaccine phase decision-making process? Committee Chair Sanfilippo said it was an overly bureaucratic and cumbersome process.
Well, as we've said all along, our ability to move more quickly is based upon getting vaccines from the federal government, who owns those vaccines. And I'll just go on a little tirade here for a second. I was on the phone with the Vice President, I think it was yesterday or the day before, when they made the announcement that they were going to empty out their stockpile and send it out to the states. And not a day, or maybe it's 2 days at the most, subsequent to that, and that would have been good news. I mean, we would have more vaccines to distribute, and we could get to 1B quicker. All the things that are necessitated in order to do a good job here in any state, frankly. And now we find out today, at least from what the media is reporting, is that the cupboard's bare in Washington, D.C. So how in the world? I mean, it just boggles the mind. And then we have Representative Sanfilippo talking about, well, bureaucratic, blah blah blah, and that's easy. You can just say that. But if we're not getting the stuff, how can we vaccinate people? If you look on one of the best websites on this issue is Brookings, and they, we rank in the top 20 of the country. Would we rather be number one? Hell yes, but we aren't. We're number 20. But to put in the context that this is a bureaucratic block here, it's not a block. The block is that we don't have enough vaccines. And so for statements like that, you expect it because legislators have to be political, but it's not helpful. And we're going to do the best we can with what we've got.
Thank you. Now to Molly Beck from the Milwaukee Journal-Sentinel. Molly?
Hi, thanks for having this call. I'm wondering if you guys have an estimate for when immunocompromised people, regardless of age, might be eligible to receive their first shots.
I know Dr. Westergaard is working on the State Disaster Medical Advisory Committee, and they're having conversations about next steps. And Dr. Westergaard, could you respond to that?
Sure. The three phases that most people are familiar with phase 1A and 1B, we've talked most about. Phase 1C is likely to be the phase of prioritization where people that have medical conditions making them at higher risk will fall. That's a preliminary recommendation that the process is undergoing. We're meeting weekly and reviewing a lot of input from stakeholders, but it is in that first, that still phase one, but in the future phases after the current phase of skilled nursing facility, long-term care facility residents, and healthcare providers.
Thank you, Molly. Now to Sean Kirkby from Wisconsin Health News. Sean.
Hi, thank you for holding this. I was wondering, do you guys support changing state law to allow dentists to administer COVID-19 vaccines? Why or why not? Thanks.
I'll pass on that if one of the DHS people want to take that one on.
Ryan, do you have any
I
thoughts?
think
See you're unmuted.
I think dentists are well qualified, as many healthcare providers are, to provide vaccines, and I think we're in an area of scarcity where the more trained and appropriately supervised people who can administer vaccines, the better. So I think that the questions are really logistical ones. I won't weigh in on the legal situation, but we're in a position where I think even students of the health professions, if they're appropriately trained and have their competencies supervised and signed off by supervisors, should be able to be engaged in this process. I think a mass vaccination campaign that is currently underway, we need to use all of the resources that we have as wisely as possible. And of all the procedures that get done in healthcare and dentistry, providing a vaccine is not terribly complicated. The challenge is just making sure that it's done in the right places at the right time and with appropriate supervision. So I think we should support expanding our workforce in all the ways that make sense.
Thank you, Sean. Now to Brett Lemoyne from Fox 6 in Milwaukee. Brett?
Hi, good afternoon. Health officials were expecting an uptick in cases after the Christmas and New Year's holidays. What trends did we see since the end of the year, and what do you attribute that to?
We saw a little bit of an uptick in early January. Watching where it goes now, it appears to be going down, and I turn to Dr. Westergaard for any further color on that.
Yeah, I would characterize the trend as sustained high levels of disease activity. Mm-hmm. Essentially, all of our counties have high levels of community spread. Several have very high or critically high. So we are clearly in a less dire situation than we were in November, where there was essentially critically high levels of transmission in all counties. So the curve has improved since then. But I think the appropriate perspective to take is that we have unacceptably high levels of disease in all areas of the state. And this is in the context of the epidemic being worse than it ever has been in the entire country. So the number of cases, the number of deaths nationwide is at its highest point. And one of the things that we've learned through the epidemic is that this is not, the epidemic curve that we see is not a one-humped camel. States or regions that were previously the worst can be in the middle of the pack or fare better as time goes on, but that's no guarantee that the fire will not burn hotter in the future. So we're in a situation where we need to remain vigilant. Disease transmission activity is still unacceptably high, and we need to do the things that we can to prevent infection wherever and however we can. And all the things that Julie mentioned as our strategies and increasingly participation in our mass vaccination campaign are going to play just tremendous roles going forward to try to get us out of this.
Thank you. Now to Charlie Robeski from Fox 11 in Green Bay. Charlie.
Hi, thank you so much for doing this. Kind of a follow-up to a previous question. So we know about the first groups in 1B, the first responders, but what about the rest of phase 1B? Who are they? When will they be vaccinated? And if you don't know when will you know?
Governor, were you going to begin?
I was going to say, one of the things that will help us know would be if the federal government would be more forthcoming with not only the vaccines, but the status of the vaccines.
Absolutely agree. A longer planning time frame would be incredibly helpful in making these decisions. But given we don't have that, at least not right now, let us tell you what we do know. So the State Disaster Medical Advisory Committee has recommendations out for public comment now. They include older adults, police and fire, educators, and people who live in congregate settings, and non-essential healthcare providers. We're receiving comment on those groups, and we welcome that public comment, and next week the committee will be making their decision and forwarding it to the Secretary and the Governor for final decision making. However, we can't wait until those decisions are made to begin to plan and prepare for expanding access. And so those plans are underway, and I think you will see expansion to other groups within that 1B category very soon. Let me just add, as I said, I've said before, we're not going to wait until 1A is all done. It's like getting on an airplane. You don't wait until Group A has completely boarded before you open the doors and start letting Group B in. And that's very much what you are starting to see and will continue to see in this process.
Thank you. Now to Rebecca Klopp from TMJ4 in Milwaukee. Rebecca?
Hi, thank you so much for taking my question today. When you talk about the federal government and the lack of more vaccinations, is there any concern in our state that we will not have second doses for people, or that these mobile clinics that you're rolling out, they're going to vaccinate people and then will not be able to do that second dose?
The process that the federal government has used to date is whenever they send us the first dose for a patient, they hold the second dose back. And so we are automatically shipped the second doses for all the Pfizer vaccine that we receive 3 weeks later, and the second doses for all the Moderna vaccine that we receive 4 weeks later. So that has been the process to date. Our counsel to the federal government is not to do anything that would jeopardize that process of assuring that there's a second dose available for everyone on a timely schedule, because based on the clinical trials that have shown the effectiveness of this vaccine, we want to follow the protocols that were in place for that to assure that our population is properly protected.
Thank you, Rebecca. Now to Rose Schmidt from CBS 58 in Milwaukee. Rose.
Hi, thanks for taking my question. I want to ask about the 9 mobile clinics that you're setting up. Can you tell us where they will be, and can you give us a timeline on who will be able to use them? And especially, I think, amid questions from the general public who may view these the same way they view testing sites, such as, the one at Miller Park, where they're obviously able to go and just anyone can go get tested. Thanks.
Yeah, right now the mobile clinics are not open to the general public because the general public is not eligible for vaccine. So they are focused on these different target population groups, unaffiliated healthcare providers, and police and fire for the ones that are opening next week. And so local health departments are reaching out to those populations and letting those populations know where the clinic will be so that they can access them. In the future, the comparison to our testing sites is exactly what we anticipate. So we're using this as an opportunity to test that model so that in the future, when larger groups of population and ultimately the whole public are available, they'll be able to access any of the mobile clinics that will be provided in communities.
Thank you. Now to Lane Kimball from News 3 Now in Madison. Lane?
Thank you for taking my call. I'm actually here today. I can't believe we've gone 40 minutes and not said go Packers, so go Packers this weekend. Wanted to ask about nursing home staff specifically. Do you guys have any kind of estimate on how many nursing home staff are opting in versus opting out of getting the vaccine? and how that compares with residents. We're seeing that residents, by and large, like 90% are getting the vaccine, but staff is a bunch lower.
Yeah, we don't have reliable data on that, partially because we don't know what the appropriate denominator is. We don't know how many staff are in each nursing home. So I don't have further data on that at this point in time beyond the reports I've heard from industry leaders, which does confirm what you've said.
Thank you, Lane. Now to Eric Gunn from Wisconsin Examiner. Eric?
Hi, thank you for this call and taking the question. Can you, for those who don't really understand this, why the prioritization at this point is important, the various phases, and would it have been possible to use simply take it from the CDC directly without redoing it at the state level, or to do it at the state level any faster than it's being done, or not possible, and why not? Thanks.
Well, let me be very clear. The prioritization is not slowing down vaccination in any way, shape, or form. And the reason we wanted to have our state committee provide insight into us is a couple-fold. First of all, the CDC guidelines were very, very broad. And if you look at 1B from what the CDC provided, it would be, I haven't estimated it, but it would probably be 2 million people in Wisconsin. And to go from a phase that's 550,000 when we're only getting 467,000 doses a month would just swamp us. So we needed an opportunity to review those guidelines, to narrow them. And we also just wanted to, like many other states have done, is have another set of expert eyes who are familiar with the conditions of Wisconsin on those guidelines, and an opportunity for the people of Wisconsin to weigh in on it. And I think all of those reasons justify why we have had our own state advisory committee, as many other states have. If I can, Jennifer, I think this is a really opportune time because it is the vaccine numbers that are holding us back. Let me give you an example here. If we wanted to have 80% herd immunity, which is our goal, by the end of June, so 6 months to do this process, we would need 1.4 million doses per month in order to accomplish that. Right now, as I said, we're receiving 467,000 doses per month. We'd need 3 times the amount of vaccine that we are currently receiving. So that is why we are not in a position to open this up wide open, and we would just be crushed by people who want vaccine and not having enough vaccine. And that's why we're using this very deliberate approach to match certain groups to volume of vaccine, and we will get there. But if we got 1.4 million doses from the federal government per month, we could get there a lot faster. And we have the people in system to deliver those doses, and we have the people who want them. We just need the vaccine.
Thank you, Julie. And we have time for one more question this afternoon, and that belongs to Joshua Pagero from WBAY-TV in Green Bay. Joshua.
Hello, thank you so much for taking my call. I know you've already touched on this, but if you can continue add any sort of closing comments to that, what was reported in the Washington Post that that the Trump administration had already sent second doses in end of December, and maybe you can shed light into not being notified beforehand about that move.
Yeah, and I'll jump in. It was just plain old obfuscation. I was told by the vice president a couple days ago and the secretary of health services that they're opening the gates. We're going to send you the remainder of the what was stockpiled. Well, I guess they may have been telling the truth because it's zero, but it led every other governor on the call saying, okay, this is good. This is a step forward. We're going to have more vaccines. We have enough to do second dose plus move this forward. And it was a slap in the face of the people of Wisconsin. And frankly, I have no idea why they made that claim when they knew it wasn't accurate.
Thank you, Governor. And that concludes today's briefing. Members of the media who did not get an opportunity to ask a question can contact DHS Media at dhs.wisconsin.gov. Also, please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.